Imagine bringing your newborn home. Tiny fingers, soft breathing, peaceful sleep. Everything looks perfect. But what if something important was missed before you even left the hospital? Something silent. Something invisible. Something that could shape your child's entire future. Newborn hearing screening is one of the most important tests a baby receives at birth. And yet, many parents don't realize what happens if it's skipped. Let's talk about why this one small test matters so much. Hearing is not just about sound. It's how babies learn language. It's how their brain builds connections. It's how they understand the world. From the first months of life, a baby's brain is rapidly developing. Every sound they hear, voices, music, footsteps, helps wire the brain for speech and communication. If hearing loss is present and goes undetected, the brain doesn't receive the stimulation it needs. And time is critical. When newborn hearing loss is identified early, ideally before 3 months of age, and treatment begins before 6 months, children can develop speech and language almost on par with their peers. But when screening is missed, diagnosis is often delayed until 2, 3, or even 4 years old. By then, the brain has already passed its most sensitive learning window. This delay can affect speech development, language skills, social interaction, academic performance, and even emotional confidence. And the most heartbreaking part? Many of these challenges are preventable. Hearing loss in newborns is not rare. In fact, it is one of the most common birth conditions worldwide. Most babies with hearing loss are born to families with no history of hearing problems. So parents don't suspect anything. The baby may still respond to vibrations, movement, or visual cues, giving the illusion that hearing is normal. Without screening, there may be no warning signs. The screening itself is simple. It's safe. It's painless. It takes only a few minutes while the baby sleeps. Small sensors measure how the ears and brain respond to sound. That's it. No needles, no discomfort. Just information that can change a child's life. If a problem is detected early, intervention can begin immediately. Hearing aids, cochlear implants, speech therapy, family guidance. And children who receive early care often grow up communicating, learning, and thriving just like their peers. Skipping the test doesn't just delay diagnosis, it delays opportunity. Every month without sound is a month the brain loses valuable input. And the longer intervention is postponed, the harder it becomes to catch up. This isn't about fear, it's about awareness. Because when parents understand the importance of newborn hearing screening, they can make informed decisions that protect their child's future. If you're expecting a baby, ask your hospital about newborn hearing screening. If you're a parent who isn't sure whether it was done, it's never too late to check. Early action can change a lifetime trajectory. One small test, one quiet moment in a hospital room, one decision that can open a world of sound. And sometimes, that single moment makes the difference between struggle and possibility, between delay and discovery, between silence and a lifetime of connection. Because when it comes to hearing, earlier is always better. And no child should miss the chance to hear their world from the very beginning. And if you're a parent looking for trusted information about hearing and child development, this is exactly why we created EarLab. A place where we simplify audiology, break down medical topics, and help families make informed decisions about hearing health. Because awareness shouldn't be complicated. It should be accessible. If this video helped you, subscribe to EarLab and share it with another parent. You never know whose future you might protect with one simple piece of knowledge.